talk about pregnancy. Pregnancy is a period from conception to birth, and pregnancy officially starts after the fertilized egg or blastocyst implants itself into the lining of the uterus. So, after the implantation, then the fertilized egg develops to become the placenta and the embryo. But the embryo will later develop to become the fetus. The average or normal duration for pregnancy lasts from 270 to 280 days, or 9 months or 40 weeks. But remember, the duration of some pregnancies can last longer, or it will not reach the average or normal duration for pregnancy. Pregnancy usually begins from the first day of your last menstrual period, and it is divided into 3 trimesters. That is the first trimester, second trimester, and third trimester. And each trimester lasting for 3 months. The 1st to 3rd month is the first trimester. The 4th to 6th month is the second trimester. And the 7th to the 9th month is the 3rd trimester. During the entire period of pregnancy, the woman will experience a lot of signs and symptoms and changes in her body. And some of the common signs and symptoms that the woman can experience during pregnancy is 1. Mixed period, nausea and vomiting, commonly called morning sickness. The breast will swell and become tender or painful to touch. Fatigue, cramping, cravings for certain food, frequent urination, bloating, spotting, and etc. All these signs and symptoms are as a result of the increased level of hormones in the body during pregnancy, and also the body trying all means to accommodate the growing fetus and keep the baby safe throughout the entire pregnancy period. One of the common changes that some women experience in their body is weight gain. Most women gain about 25 to 35 pounds of extra weight during pregnancy. Many women first discover they are pregnant after a positive home pregnancy test, even though they will be already having some of these common signs and symptoms of pregnancy. Home pregnancy test is when a woman uses a pregnancy test strip or a pregnancy urine test stick to test the urine at home to check the presence of HCG in their urine, which will give them a positive feedback if they are pregnant, and negative feedback if there is no HCG detected in the urine. HCG is a pregnancy hormone, and it is produced after the blastocyst or fertilized egg have implanted itself into the lining of the uterus. These hormones help taking up the lining of the uterus to support the growing fetus and also to stop menstruation throughout the entire period of pregnancy. Because the production of HCG starts after implantation, sometimes home pregnancy tests can give you a negative result if the level of HCG in the urine is very low or if there is no HCG in the urine. Home pregnancy tests are more than 97% accurate if it is done well. But if you get a negative result and there is no menstrual period within another week after a mixed period, then the pregnancy test should be repeated. Even though home pregnancy tests can be accurate, they are less accurate than the pregnancy test done at the lab or at the hospital by using the blood. Once pregnancy is confirmed, it is recommended that you immediately book an appointment with your GP, midwife, doctor, or your healthcare provider to get the antenatal pregnancy care and also all education and information you need to know to have a healthy pregnancy. Your midwife will book your first appointment with you so that any care and services for pregnant women can start as soon as possible. And this is called your booking appointment. During this appointment, your previous health and pregnancy data and information will be taken, as well as your current health status. All necessary health and blood screening will be done, and also early pregnancy scan will be done to check the well-being of the growing embryo. If there is any concern about your health, an immediate intervention or treatment will be given to ensure a safe and healthy pregnancy. Your midwife will also tell you about your choices for antenatal care in your local area and the ways to access them, and any other extra services that is given to pregnant women during pregnancy. Your doctor or midwife will educate you on the importance of healthy eating habits, because now that you are pregnant, you should eat a lot of fruit, drink a lot of water so that you and your baby will be healthy. You will also be advised to immediately start taking 400 mcg of folic acid. This helps prevent your baby developing spinal cord defects such as spina bifida, and other multivitamins will also be recommended. You will also be educated on the things to avoid during pregnancy, such as stress and any other lifestyle that will risk your pregnancy. You will also get the chance to ask any question or tell your midwife any relevant information that they should know about your lifestyle or any other health concerns for possible solution and intervention. That is why it is very important to start your antenatal pregnancy care as soon as possible and attend all your midwife and doctor's appointments during pregnancy. You should also let your midwife be aware of any current or past medications, or if you are allergic to any medication, food, or anything, because it will help them provide the best care for you. Remember, pregnancy can be tough and physically demanding. That is why it's important to seek help and support from your families, friends, and healthcare providers, such as your midwife, doctor, or any person who can give you some sort of help whenever you need any support physically, emotionally, mentally, and financially during pregnancy. This video have covered a lot of information that you need to know about pregnancy, and I hope you've learned something today. Thank you.